Welcome to rePROs Fight Back, a podcast on all things repro. I'm your host, Jenny Wetter, and each episode I will be taking you to the front lines of the escalating fight over our sexual and reproductive health and rights at home and abroad. Each episode, I will be speaking with leaders who are fighting to protect our reproductive health and rights, to ensure that no one's reproductive health depends on where they live. It's time for rePROs to fight back. Welcome to rePROs Fight Back. So far in this podcast, we've spent a lot of time talking about the various attacks on sexual and reproductive health and rights. And that can kind of be a downer and a bit of a bummer. And so I'm really excited to take time today to talk about proactive things. So we're going to talk about proactive legislation that was just passed in New York. So I'm really excited to have with me today Laura McQuade from Planned Parenthood of New York City to talk about New York's new Reproductive Health Act that was just signed into law last month. Hi, Laura. Thank you so much for being here.
Hi, Jenny. It's great to be with you today. Thank you for having me.
Again, I'm just so excited to be talking about good news for once. It's such a nice change.
We are too. We are too.
So before we talk about the new law, we should maybe just talk a little bit about what did abortion access in New York look like before the Reproductive Health Act?
To be honest, there's not a lot of change in access to abortion care in New York as a result of the RHA. Why? Because we really operate under the protections of federal precedent, right? We operate under Roe v. Wade, Planned Parenthood v. Casey. We operate under that law. Mm-hmm. And so we had access here, as we do across the country, contrary to popular belief. We have protections up to 24 weeks or viability, and we have protection for life and health of the mother, as well as if the pregnancy is not viable. However, as you've just alluded to, all of those are under threat at the national level. And what the Reproductive Health Act did was make sure that those protections that I just articulated were written into New York state law, so that regardless of what terrible things may be coming down the pike from the federal government, we will have those written into law here in New York State. And I know we're going to go on to talk about some of the other things in the law, like allowing advanced practice clinicians like nurse practitioners and physician assistants to provide care, but those are some of the other pieces. But specifically around the legal piece of it, it's making sure that New Yorkers have in their own state law the protections of current abortion rights in the United States.
And making sure it's ruled as a public health issue instead of a criminal issue, which was a huge change.
Right. And again, as a reminder, New York passed its abortion law in 1970. It was one of the first laws legalizing abortion 3 years before Roe in this country. And at that time, it was a law that was placed in the penal code. It only gave an exception for life, unlike life, health, and viability, which came later under Roe. And because it sat in the criminal code and not the public health code, it came with a lot of barriers and restrictions for providers who oftentimes had fear of providing care, even to the extent of the law here in New York State. So this is a big change for us.
And so there's been a lot of discussion about the Reproductive Health Act since it passed, and a lot of the opponents have been very vocal in saying what they say it does, which, you know, we even heard in the State of the Union this last week talking about, you know, basically killing babies after they're born, which is obviously not what this does. So let's talk a little bit about what it actually does.
So what this law does, again, it is legal in the United States to have an abortion through viability, which is generally thought to be around that 24-week mark. And if there has to be an exception because of the life of the patient, the health of the patient, or the viability of the pregnancy, that is already the law here, and it is now New York State law. But some of the other amazing things that this did and why it was so needed, we just talked briefly about taking it out of the criminal code and putting it right where it belonged in the public health code. There is no other procedure, healthcare procedure, that sat in the criminal code. So again, taking away that abortion exceptionalism and stigma that has existed for so long. The next piece is around who can provide abortion care. Right now in the state of New York, surgical abortion can be provided explicitly by physicians only. And the change in this law actually opened that up to include advanced practice clinicians, who include nurse practitioners, clinical nurse midwives, and physician assistants, who can provide medication abortion, but also first trimester surgical abortion, as long as they are trained and signed off on appropriately. And so those are really the key components of what's written into this law, and why we're so excited that we will have protection, but also what is really an expansion of care to communities that may not have physicians and rely on advanced practice clinicians to provide their care.
There's so many pieces to pull apart here that are so important to talk about. And I think one of them is, the cavalier way that they've been talking about, that they seem to think women make these decisions, that there's just like this huge group of women that are just putting off getting an abortion until right before they go into labor, which one is just flat out not true. But also, I think it's just important to talk about most abortions, the vast majority, are in the first trimester. And just that the way that the conversation has been happening has not been in a helpful or truthful way.
But make no mistake, that is a calculated conversation on their part, right? They know fundamentally well what this law says and does not say, but that's not sexy. That's not mobilizing of their base. And so they will stop at nothing. Flat out lies about what abortion care is and who seeks abortion care and how. That is part of a narrative, and they have absolutely no qualms about telling lies and spreading misinformation on a daily basis. So when you talk about abortion care and what it looks like, so more than 90% of abortions in the United States happen in the first trimester. And then as the gestational age increases, that percentage gets smaller and smaller. So according to Guttmacher at this point, just over 1% of all abortions in the United States happen after the 21st week of pregnancy. And so they don't actually want to have a conversation about healthcare and what is actually happening. They want to go to the end of the spectrum that is so necessary and so needed, but it is rare. People make those decisions for reasons that I can't judge.
Right.
But they have their reasons, and they don't do it lightly. Any decision that we make about healthcare and seeking access to healthcare, women have the ability to make those decisions for themselves. And they make them for the reasons that we don't have the right to say why they do or don't make those decisions. But I can tell you that nobody gets to our door having not thought about what is their healthcare situation, what are the implications of either decision that they have, carrying a pregnancy to term or not. They have the ability to make those decisions.
Yeah, I think the lack of ability to trust women in making these decisions is so clear on the other side.
It absolutely is. It's ingrained in that conversation. It's also why women are also not given autonomy, even in the restrictive laws. The laws are always against the physician because, again, it's taking away that autonomy and decision-making of the patient because you can effectuate so much more control if you can actually take that out of the equation. And every law that's passed, there's an inherent belief that they have the right to do so.
Yeah, and this isn't really relevant. Well, I mean, other than relevant to the larger abortion conversation, but not relevant necessarily in New York. Just like the shaming you see put into the laws and the lack of respect for women, right? So like a waiting period being like, you need to like go home, honey, and think about this some more before you can make your decision. Or saying you need to have an ultrasound to like look at what you're doing and think about this before you do it.
So you may not know this, but before I was the CEO of Planned Parenthood of New York City, I was the CEO of Planned Parenthood Great Plains, which provided abortion care, full sexual and reproductive health care in Missouri, Kansas, Oklahoma, and Arkansas. And we had across those states 3 different waiting periods: a 24-hour waiting period, a 48-hour waiting period, and a 72-hour waiting period. And part of it is about putting as many barriers in front of the patient as is humanly possible, putting as many barriers in front of the provider as is humanly possible. But the underlying theme is what you just highlighted. Women are not capable of taking the information available to them, taking their own circumstances, synthesizing the two, and making a decision. We, the state of Missouri, we, the state of Oklahoma, we need to guide you because you're incapable of making this decision on your own. So it really is a twofold. They get kill 2 birds with 1 stone in those laws.
Okay, anyway, back to the Reproductive Health Act. Sorry, that was a little bit of a sidetrack, but important to talk about where these laws are coming from.
Absolutely. And we're seeing them happen over and over and over again. Hundreds are being introduced annually.
Yeah, it's bad. Although the good news was last year was the first year ever that there were more proactive laws introduced than negative laws. And so that's something to look forward to. Hopefully that trend continuing.
Well, I think that's what's so exciting about the Reproductive Health Act and what has our opponents so fearful, right? First of all, the electorate is waking up to the importance of putting elected officials in office who believe in these issues and will vote on these issues. That's exactly what happened in New York State. We were only able to pass the Reproductive Health Act after we flipped the New York State Senate, which had been blocking this legislation for more than a decade, to a pro-sexual and reproductive health majority in the Senate. And so people are waking up, elected officials are waking up, and that is what is terrifying those who have controlled this conversation for decades, who have taken over through an outsized minority state legislatures across the state. And so this is being driven by real fear of what could be happening when people realize the rights that are at stake and that they actually have some power to do something about it to effectuate change.
So the one part of the Reproductive Health Act we've kind of touched on and I wanted to go back to was expanding who could provide abortions, because coming from a rural area that didn't have easy access to an abortion provider, this would be a real game changer for women who live in areas or people who live in areas that don't have easy access to a physician.
That is exactly right. I mean, there's been such a material change in the delivery of healthcare since 1970 when our law was passed, right? Nurse practitioners didn't exist. Certainly, and that creation of a whole other group of clinical providers in our country didn't exist. So a lot of people say to me, well, why weren't they written into the law at the time? Well, they didn't exist. I don't think people realize the extent of care, primary care, sexual and reproductive health care that is provided by these advanced practice clinicians, particularly outside of large urban centers. And so having more providers being able to provide first trimester abortion care and through in-clinic or medication abortion, which is what 90%, as we just talked about, of all the abortions happening, is a game changer for communities. Patients are having to drive, as we know, we've heard the stories, Texas, Kansas, where I worked, Oklahoma, hours to be able to reach a physician who provides abortion care. And so bringing care to patients in communities where the need is thrilling.
Yeah, I mean, I can definitely see that. And again, going back to where I'm super familiar with this, Wisconsin is they're down to 3 clinics, and it's Milwaukee and Madison, which are very southern Wisconsin. So there are huge swaths of the state that they don't have access.
And so what we're hoping to do, again, and we'll talk about this probably a little bit later, about what are some things that we could be doing to figure out how to change that landscape, particularly around advanced practice clinicians providing care, more care across the country.
And I think we touched on this a tiny bit, but maybe a deeper dive as to why it's so important to do this right now.
Why? Because for the first time, we are facing a Supreme Court minority on our issue. When President Trump announced his nominees for the court, before we even got to Brett Kavanaugh, the litmus test was who was going to be willing to overturn Roe v. Wade. It was a litmus test in his selection of candidates to be considered. We know, despite the rhetoric on the other side, we know where Brett Kavanaugh stands on the Roe v. Wade decision as a legal decision and where he stands personally on the issue of access to legal abortion in the United States. And there are countless cases sitting, waiting to be determined whether the court will take them up. So it is, we believe, a matter of time before the court rules in a way that may not overturn Roe. I'm not that naive, right. But the further gutting and erosion of the federal protection that will allow states to further restrict to the point that there is no access. You mentioned Louisiana just a moment ago. And so what I think is the ultimate irony here is that campaigner Trump talked about how abortion was something that needed to be determined at the state level. So what did we do here in New York? We went out and we passed the law that we wanted and needed for our citizens in the state of New York because we fear the loss of it at the federal level. And so I do think that's the ultimate irony that he says it's really a states' rights decision. And now that it's been decided at the New York in New York State, he's doing all that he can with his base to chill others from making those decisions at the state level. But that's what's coming. And it could be a year, it could be 18 months, but there will be some sort of erosion in the rights in a fundamental way in fewer months than I care to contemplate.
Yeah, and I mean, when you think about it, it's not going to take that much to quickly make abortion not a reality in several states. What are we at? 7 states that only have one clinic? It doesn't take much to find, maybe a trap law, which is what they're under consideration in the Louisiana case, that would close that clinic and leave women with having to travel great distances because, it's not just that state. It's often kind of this block of states where you could have women, particularly in the South, that are going to have a long ways to go. And that's going to really impact the women who are least able to afford it.
Right. And we have legal precedent in this country, not just around abortion care, but around other fundamental civil and human rights issues that a person cannot be forced to leave the state to exercise their fundamental rights, whether that's about access to health care, access to education. Again, I'm not a lawyer. I like to sometimes play one on TV. But that's we're in a totally different legal environment now. And what we're seeing happening in Louisiana is a pullback of that earlier jurisprudence. And so we can't rely on that which we relied on previously. And again, I always like to do my shout out for the Midwest. I mean, there is an abortion desert in the middle of this country. There is a sexual and reproductive health care desert in the middle of this country that links right up with that abortion desert and sexual and reproductive health care desert in the South. We know that if Roe is materially gutted, that 22 states will move to make abortion fundamentally illegal in their own states. And again, we no longer have the judicial underpinnings for that protection at the federal level. And that's frightening.
Yeah. This is something you can really see. So I work for the Population Institute, and every year we do a 50-state report card on reproductive health and rights. So it looks at abortion, but it also looks at a number of other things like sex education access. And you see this big red swath that goes right down the Midwest to the South of states
you
that
gave
are
us an
failing
F.
grades.
You gave the state of Kansas an F.
Yes.
I'm trying to remember.
There were 19 Fs this year.
Yeah. So you gave the state of when we were still there. And now Kansas is in a different space, right? It's fundamentally changing because of the electorate, right? Having Laura Kelly sitting as the governor of Kansas
makes a huge difference.
It makes a huge difference. But yes, I remember all too well That big, fat red F. Kansas got, I don't know whether it was 2015 or 2016.
I think they've had one most of the time we've done it.
Yes.
That's okay. I've been watching Wisconsin, who started at a B when we started doing it. So this is like our 6th year, and they've had an F for, I think, 3 years. So it doesn't take long to change it, but that also means it might not take long to change it back.
That is exactly right. And that is why, this is such a moment of empowerment in this country. We could talk for hours about the reasons that people lay dormant for far too long, and that's why we're sitting at this moment. But I am a glass half full kind of girl, and what we saw mobilized in the midterm elections, what we saw mobilized in New York State that allowed us to be where we are today, not just on the Reproductive Health Act, right? Contraceptive coverage, protection of rights for our transgender community here in New York, more protection for immigrant communities, voter rights, right? You have a power in your electorate to affect change. It's such an opportunity out there. People are mobilized. Elections matter. Getting smart on issues matter. There are things like fake news, right? And getting educated and really understanding what the facts are. And then taking model legislation. The Reproductive Health Act is a model. Our friends on the other side, they have a model legislation playbook. The National Right to Life promulgates legislation that happens at the state that they put out to multiple states. Why don't we think about looking at model legislation, right? You need the electorate and the elected officials to do it, but there are a lot of things that we can be doing now to kind of move this forward. And I think that is what is really sparking some of the just hideous, repulsive lies that the president spoke about in the State of the Union, that we heard about from Cardinal Dolan right here in New York City the week before.
Originally from Milwaukee.
Right. And so it's fear that there will be real and material change.
So we're talking about good things, and so let's keep going. What else would you like to see? Like, if you have your wish list, what else would you like to see for proactive legislation in New York, or if there's broader?
Sex education is at the top of our list. New York State and New York City, we are failing our youth and our teens and our young adults miserably. We are failing. It is the last thing on the bottom of anyone's list, right? We've got some kind of loose mandates at the state level. Here in New York City, you're required to have one class in middle school and one class in high school. And I have a high schooler. And I always joke, I'm like, he's really good at calculus. He takes calculus. But what's the likelihood, how often is he going to use calculus after he leaves high school? But how often is he going to be in a relationship? How often is he going to have sex? How often is his self-esteem going to come into play in his own life and the lives of those he has a relationship with? And yet we have no mandates around that. We have an epidemic around consent, right? Around violence, not just violence against women. It's pervasive in the LGBTQ community.
Absolutely.
And so that is a big, big, bright, shining star that we're focused on here in the state of New York is universal, I would say it used to see K through 12, but universal pre-K through 12 sexuality education. Big deal if we could try to move that forward here.
That would be amazing to see. And I feel like that's one of the things. There's a couple states that always surprise me every year. You think I would remember doing the report card, is going through and saying that New York isn't as strong as I would hope it would be.
We are not yet the state we think we are. I coined that phrase when I came back from the Midwest, right? You have your eyes open. You think you live in this bubble, right? And then you spend 3 years in, for our issues, kind of the belly of the beast around sexual and reproductive health care. And then you come back and you look and you see that you either have laws in place that look like trap laws. You have no educational standards in place. And you're like, wow, we have a lot of work to do. Get out, get mobilized, feel good about what we've done, but realize how much more there is to do, even right here in the blue, purple, red, depending on where you live in this state,
right.
State of New York.
Great. So we always like to end the podcast focusing on what can people do to fight back. So We have listeners all over, in the U.S. mostly. So what can they do, looking at what New York has accomplished and what you would like to see New York accomplish? What can they do in their own states to push for proactive reproductive health care legislation?
I always start with the voting part.
Yes.
Okay.
So important.
There is no seat. I don't care where it is. There were seats that were turned over in New York State this year. People told us, people told other parts of people of the advocacy community, you will never take that seat. And we said, okay, we're still going to invest. And if we don't take it this time, we'll take it the next cycle. But we took seats that people said for years you could never touch. Those legislatures, you talked about Wisconsin, right? Those seats weren't taken by accident. Right. And if they can be taken, they can be taken back. And so, and don't be discouraged if it can't be one cycle. Staying engaged is really hard.
Yeah.
It really is. It's exhausting. But I would say there is such a groundswell. There is support in a number of corners. There's money for this work. There are organizations who have indivisible, right? All groups that have sprung up that are doing this work more than ever. Find the one that works for you and get involved and stay positive. A lot of this, they didn't take it in one cycle, and we probably can't take it back in one cycle, but work toward that. And I would also say it's hard not to be sucked into what media tells you. We want small, short answers to our questions. There are no small, short answers to sexual and reproductive health care, right? Immigration, racial justice, economic justice. There's not a tweet or a soundbite for that. It is hard work, and it is passion, and it is commitment. And stay smart, stay dedicated, and don't beat yourself up if today all you can do is repost a tweet. Because whatever you can do on any given day is more than doing nothing. And give what you can when you can. Stay smart, stay focused, because we can do this. And then I would say take advantage of things like model legislation. Like if you are more politically active and somehow you lobby or you're working in an organization, put a piece of model legislation in front of a supportive legislator. Run it through, even though you can't win that cycle. Start to build support for it. That's what we did with RHA. This was a piece of legislation that was written more than a decade ago. We updated it when we went into this cycle, but it wasn't the first time around when we had the legislature. So it's in the long term, we're dead. I get it. In the medium, this is a medium term gain for all of us. And I would just encourage people to stay positive, to stay connected. Don't beat yourself up. Don't beat others up, and just keep moving forward.
Great. There's nowhere to go for that, because that is so positive, and I think that is the perfect place to end.
Well, thank you so much for the opportunity to talk with you, to talk about this important issue today. I'm so proud to have had the opportunity.
I'm so grateful that you did it. So thank you, Laura.
Thank you.
For more information, including show notes from this episode and previous episodes, please visit our website at reprosfightback.com. You can also find us on Facebook and Twitter at reprosfightback. If you like our show, please help others find it by sharing it with your friends and subscribing, rating, and reviewing us on iTunes. Thanks for listening.